Well, obviously I would ask for their name. I would do my best to make sure that other people in the room didn't hear what I was saying, but sometimes it's just really crowded, so they might hear me. But I would find out their name, and I would find out what their prescription was, and maybe find out why they needed it, like what they did. And I would make sure that they knew, like, for example, if they couldn't take the prescription with alcohol or something, then I would tell them about this one time when I was on this prescription and I drank alcohol and I blacked out for 2 days, so that they knew that they shouldn't do that. Basically I would just find out if they had any questions, maybe ask how they're feeling, and yeah, see whether they were recovering from the last time that we gave them the wrong prescription. Well, the checkout portion of the pharmacy is where the most customer interaction occurs. At this point, the pharmacy is given an opportunity to get to know the customer as well as improve customer satisfaction. At the close of a sale, of course, I'd be well aware of the HIPAA laws and ensure that the medical information was only exchanged with the customer who was paying for the prescription. Once I had verified that the customer's information was correct, I would go ahead and complete the transaction to close the sale. At this point, I might also ask the customer maybe how he or she is feeling, or how their surgery went, or whether they have any questions for the pharmacist. Well, as a healthcare professional, I believe that it is absolutely my duty to ensure the patient's privacy is protected. Whenever a customer comes in to pick up a prescription, I would, of course, be extremely professional, and I would always speak in a soft voice as to respect the medical and personal privacy of each patient. In every instance, I would first ask for the first and last name of each patient and also find out how many prescriptions they had come in to pick up. And once I had received this information, I would go ahead and retrieve their filled prescription for them. To ensure that the prescription's correct, once I've picked it up, I would verify their address and the date of birth of each patient. And if that's correct, then I would proceed with the sales transaction. Also, in alignment with pharmacy protocol and HIPAA law, I would always at this point ask the patient whether she has any questions for the pharmacist. At this point, if they do not have any questions, I would complete the transaction and I would go ahead and collect the necessary signature. If they do have a question, in the same manner, I would complete the transaction, but I would ask the patient to go ahead and wait in the conference area while I notify a pharmacist that there is a patient waiting for them.